Welcome to Morning at NTV. My name is Idris Matusegawa and we have entered the hour of Taking Note, looking at important topics that affect you at home and the world at large. Now, did you know that 1 in 5 Ugandans still live in extreme poverty and more than a third live on less than $2? That is about 8,000 Ugandan shillings. Unbelievable, right? But according to the latest World Bank economic analysis, providing social safety nets to Uganda's vulnerable families and citizens experiencing poverty and destitution can support investments in human capital, reduce vulnerability, poverty, and thereby help drive inclusive economic growth. Now in studio, I'm joined by two beautiful ladies. Allana Kembabazi, a programs manager, ISER, Initiative for Social and Economic Rights. Good morning, Allana.
Good morning.
Good to have you.
Yes.
And Fiona Nanyonjo, a lawyer and activist. Good morning, Nanyonjo.
Good morning.
Well, these ladies and I, we are going to discuss the status quo of social protection in Uganda, and you can join the conversation just by simply going to our social media platforms, that is on X, Facebook and YouTube. Use the hashtag Morning at NTV. You who is not able to access a TV set, you can still watch this conversation live on YouTube. Just type in NTV Uganda and later on the recorded conversation will be available to you. I'll start with you, Fiona. For someone who does not know what social protection is, what is it?
First of all, thank you so much for hosting me.
Thank you for coming.
You're welcome. I'm Fiona Nanyonjo, a lawyer and a human rights activist. I'm from Machinje, Nkere, Navisaro zone. I don't know if you've ever heard of it.
I've heard of it.
Yeah, ghetto areas.
Yeah, for sure. You might be contesting for LC1 so in 2026. Yes, the areas broke it down. Yes.
Yeah, so social protection, we are looking at those public and private interventions that help protect Ugandans from vulnerabilities like poverty, shocks like COVID-19 that we experienced. And in Uganda, we have a very low coverage. For example, 6.2% of people, 90% of people are still are not covered under social protection. And most people don't know that social protection is a right. It is a right which ensures the dignity of people in Uganda.
Fiona.
Yes, please.
You've mentioned that a number of people are still under poverty. But then you mentioned social protection as a right. But how do I start even demanding for that right when I don't know what it is and how I attain it? What is social protection for a mwananchi who's at home, who's watching? I've never heard of this word. Please, again, break it down so that I know what right I'm supposed to demand for.
Social protection. These are interventions that help protect Ugandans from vulnerabilities like poverty, shocks like diseases, for example, that COVID-19 era which we had. Yeah. So
the interventions that we saw whereby people were coming in, individuals and the government providing posture to people, food, some assistance, is that part of social protection?
Yes, please.
Okay, so I'll come to you, Kembabazi. Social protection, as you, a person who belongs to a non-governmental organization, how do you then intervene? How do you help the citizen to access this right?
One, because it's a right,
Yeah.
I actually think the responsibility does lie squarely on government.
Yeah.
Now, of course, when you look at the African Union, the protocol on the right to social protection and social security at the African level, and even government's own intervention, they sometimes say, you know, it's both government and individuals.
Yeah.
But the reality is you pay tax. and also you agree to abide by rules in a state. It's a social contract. I will keep your rules, I'll pay tax, I will agree to be part of the state, and there are certain things you do for me as a state. And at the heart of social protection is the idea that you're cushioned. In Uganda, we like to think it's for old people. Social protection, the money for wakade. No, it's supposed to happen across your life cycle. You're cushioned. You know, so I mean that when you look at a child, for example, education is a part of social protection. Are they able to access free public education? Right? Are they able to access school feeding, for example, which is something we are grappling with as a country? You know, health care. And then even the mother giving birth at that time, can she give birth safely? Is there health care free, sufficient, like public, not you can go to private, no. Some sort of measure such that regardless of your ability and what's going on in your life, again, you are cushioned. If there are a child with a disability, are there certain protections for them? Are there certain accommodations being made for them? Then you go to us, say now you've gone through school, your working age, you're us. Something like COVID happens. You lose your job or you lose your income, what happens? How do you deal? So there must be some interventions there, and that's why you saw like a bit of one of the things we successfully advocated for government to do was to give cash transfers. Granted, there was mismanagement and they were one-off, but I applaud them for stepping up in that moment, right? Because it recognized that at that time you need to cushion people, right? And then you get to your old age, and the challenge with old age here is, yes, so if you're a pensioner, if you've been working for government, you get some pension. That there is there. It's the earliest form of social protection in Uganda, by the pension. But if you're a pensioner, then you get this, you have to be 80 years old to get the social assistance grants for empowerment, because they only go to those above 80. How many Ugandans above 80? Remember, most people, you're supposed to retire by 60. Between 60 and 80, there's a huge gap. You're not covered. Even if you are 80, you get 25,000 shillings, and that amount has stayed the same since 2013. You people, 25,000 in 2013. My border ride, what it cost in 2013, is not the same right now. And then, you know, if you're not in those two categories, maybe you're like us who work for NGOs or you've been other form of employment, you're expected to have contributed to NSSF. But NSSF is a one-off payment, and you've seen what the data shows. By the time you're getting to 80, the money is gone because it's a one-off payment. And social protection should be regular. That is why, yes, cash transfers can be a form and NSF, but for it to be considered really social protection, it should be regular to cushion you. So if you're having a challenge, you're not just left hanging. And I think that as Ugandans, and I want to speak as a Ugandan, yes, I'm an NGO, but people, this is our country and we pay tax. As Ugandans, you should demand for this. If we can say, oh my God, we must find money for census, for elections, why can't we say we must find money for social protection? Because it's a right. In our constitution, there's a recognition that older persons, for example, deserve certain protection, right? There's a recognition that if you're a vulnerable group, women, persons with disabilities, that they deserve some extra measures. So there's already a sense of it. It's not as clear as it could be, right? But it's there. And then you have the National Social Protection Policy, which also begins to get into this, which is a great policy. Unfortunately, there is no proper law like Kenya has that would really give it that bite.
Oh, there is none?
There is no, there's no enabling law, so that is the gap that the government moved. It has a policy, it has been taking measures, but they don't have like an act that would cover that. So you have the NSF Act, you have, you get it, there are acts that cover certain elements of social protection, but not one that comprehensively covers. For example, where does SAGE fall in the law? Right, the grants for empowerment, like that's I think a gap. But at the same time, you're seeing government is constricted, it's trying to move and implement, but there are certain things it should also put in place, like some of the enabling laws, and also of course what they're doing you could consider insufficient given the cost of living crisis and how limited the coverage is, right? So that's what I would suggest, and I would think that the other ways in which we should be involved in this discussion is like research and see what other countries are doing. One of the things that ISER is doing right now, we have looked at the protocol on the right to social protection and social security. And I like this protocol because it was signed by the African Union. Like, it wasn't, oh, from America, where no, African states sat down and said, this is important. And so we've been assessing Uganda, and we should be launching our research in about in a short while and seeing how are you doing. Like, yes, you're saying you're doing social protection, and one of the things we found is in this country, like I said, there are bits of social protection for different categories. But the idea that it's a right is not coming through very strongly. And the idea that it's supposed to happen across your life cycle, you know, and that planning is still not coming through as strongly.
And Fiona, I would like to come to you on that. Kembabazi mentions that the idea that social protection is a right and the lack of legal policies or legal frameworks to ensure that this as a right is actually activated. Why is it that so? As a lawyer, what is the law, the Uganda Law Society doing about that? Or as a lawyer, how do you push so that these policies are put in place?
Thank you so much. First of all, lawyers are making sure that laws are being enacted and people get to know about their rights when it comes to social protection. They get to know that, for example, the elderly, they receive their pensions in time. The school-going kids, they're able to receive food, housing, and those families, for example, in ghettos, in poor situations, they get to know that they have a right to live a better life. They have a right to have good nutrition, good healthy care, and improve their lives.
Yes.
Well, and I'll come back to you, Allana. You mentioned that at 80, older people can only access that fund at 80. But it has been reported that Parliamentary Forum on Social Protection recommend that government considers lowering the eligibility age for the senior assistance grant for empowerment to around 70 years old. Was this put in play, or and what is the possibility of making this work?
So you have to remember where SAGE started. SAGE was initially 60 in Karamoja and 65, but in a few districts. So one of the things that ISER did in 2017 was we went to the Equal Opportunities Commission and filed a complaint against government.
As you should.
As we should, so arguing it's a right.
Yes.
And we argued discrimination. For you, why are you just in a few districts? Don't all the people of these other districts deserve that?
True.
And so, you know, the Opportunities Commission said, roll it out. Government said, but we are going to roll it out, it's okay. But we shall start at 80. But the Equal Opportunities Commission told them, roll it out, and if you say you're starting at 80, every year you should be increasing the age, like doing better to try and include more people, and give us an annual report. That was 20, they have not done that. So they said they were starting at 80 for budgetary reasons. And I think we told them, look at the data, how many Ugandans make it to 80. We have people who are part of our petition at the time who have passed and they never got this, and they live in absolute hardship. It's I think it's actually discrimination. If you can recognize someone who works in government at 60 should retire because they are getting a bit weaker, and you recognize they should get pension, why can't their fellow person who is arguably living in poverty be able to also get it? And now government has been trying to do this thing where it's giving them some sort of assistance between 60 and 80, but it's not social protection in our view, because social protection has to be, there has to be a regularity to it, a cushioning effect on it, right? And we've argued for us that actually it should go back to 60. And I think it's a discussion. Elections are coming up, older persons, you vote your leaders. I think it's a thing you should be asking them. What about us who are 70? What about us who are 60? And how, because this money does help. You know what is interesting is they found that it has a ripple effect. When you give an older person this money, of course they use it in the economy, right? Food and so forth. But they also use it to pay sometimes for their grandkids, whether healthcare or education. You have to remember that in our society. Yes, and there's this gap. Remember, HIV came, and there's this gap that people sometimes forget, that where you have grandparents looking after their grandkids and there are no parents in the picture. Or maybe they've left and they've gone and to Kubache, whatever it is they're doing, and they're not in the child's life at all. So it has a ripple effect, and government needs to step it up. And government, even though it has said it wants to, I know that the expanding social protection unit has often said we need to move progressively towards going upwards beyond 80, 70, 60, you know. But look at the money they are giving. It is stagnating. You know, you find that even the people they are covering, with that money, you will not achieve your objective of increasing more. And now this is very important because we are in the budget cycle, right? So this is March. Ministerial policy statements should be coming out. Yeah. The budget from AFP already came out. So we should be going towards concluding, actually, the budget. And this is when you'd have expected government to do so. And I keep saying that if you can find money for other things, then you can find money for this. How much have we been losing? I mean, the parliamentary exhibition is going on. How much do we spend on corporate social responsibility, which I don't understand what Parliament is doing on? There could be more intentionality about funding it and increasing it older persons. And even, by the way, those who are above 80, because we've been and interacted with them, and we have another case now against government, those who don't have a national ID can't get it. And this is the thing, when they were registering for national IDs, most people, some of them you could not get the thumbprint. There were issues with that because of whatever, you know, the digging, all of that. A number of them just never got registered because to get to the access points, a number of them, the officials themselves are the ones who made the error. There's a lady who everyone knew, like, we had to literally go and begin to seek government intervention because her date was captured wrong, and because of that she couldn't get money. There is one where you find the twin sister is getting the money, the other one is not. In my dad's village there is one where that son is getting money and she's not. Do you see the irony of that? And we've been arguing. National ID, we've always existed. National IDs are great, but we have existed with other forms of ID. Why are they the sole form of identification for this old person to get their money? When you know for a fact that millions of Ugandans still lack ID, that NIRA itself and government of, you know, someone in Parliament was looking into this, there is a lot more they could do to really strengthen the rollout of national IDs. But in the meantime, you have so many older persons they are not getting this, right? And so there are two challenges there in terms of government's, I think, lackluster commitment on this. One, financing. Two, the insistence on a national ID. And the fact that you're still there and saying close to 80. So me, I'm calling on people, voters, to put whoever is coming to you for a vote to ask for this. And I want to underscore that under the African Union protocol on the right to social protection, this is supposed to be accessible to all. Actually, at the heart of it is supposed to be non-discrimination. And the fact that governments are told, look for the money. How do you get the money? Progressive taxation. Make sure you're taxing, make sure you're curbing corruption, curbing illicit financial flows. You know, we have multinational companies that don't pay their fair share of tax. We have money that leaves. You know, the President has talked about, okay, yes, you will launder, but I'll try to make it hard to leave the borders and all of that. But the reality is there is money that is leaking. And the African Union, as Africans, we say, the leaders and the ones who adopted this protocol, they were saying we must make sure that we look for all the sources of money to actually fund it, and a government should have a clear picture of what the funding situation is like, what the projections are like.
From what you're saying, I get the sense that there's lack of prioritizing, helping the vulnerable. Are there some challenges that probably government and these other bodies are facing, probably like lack of data, poor information systems, that cause this inconsistent social protection coverage?
Yeah, I mean, they do struggle with data. Remember during COVID when why we argued as ISER for conditional cash transfers, or when the cash transfers for everyone, was because they didn't have the data. We also believe it's universal, everyone was suffering, but they didn't have the data. That was the reality. And you remember what happened when they gave the money, then later on it turned out the first caller was over from which office. So there's a sense of not having proper data, and they've been trying to set up a system and a registry, and that's a challenge because I think you need data to plan. But even with the data you have, are you actually planning and implementing the best of your ability? Because the reality is they know the data is there about how many Ugandans are poor. That's a starting point to plan. About, for example, how many school-going children are there, so you can make sure your public school, because people forget that. And the public education thing is a critical part of social protection in the protocol. But how much are you giving? If there are this many students, why are you giving capitation grants of 20K per child per year? Like, what are you doing with that, right? So even the data you have, You're not planning and financing, and that's why you will see that within government, you see that, for example, Ministry of Gender, there's expanding social protection unit, right? It will give you the data, it's trying to make a new strategy and everything. But now, how is Ministry of Finance coming to back? How is Parliament coming to make sure there is relevant legislation? Because they've already identified the gaps. There's a department that identifies the gaps. But how are the other governments now working to address it? And I think in this country, we have seen what COVID showed us is when there is political will, things can move very quickly. Like you wake up, I never thought I would sit there and then they are talking about even cash transfers. Or, I mean, you people, we've gone through so much. And that's the thing. If we recognize that COVID-19 came and it shook our worlds, and it showed us how we could all be vulnerable. This should not be discussions. If you're a person right now of working age, you've realized life can change in a blink. Why aren't we all fighting for social protection? An older person, when we brought that complaint against government, one of the petitioners with us, he stood up in the room and told us, I'm not fighting for me, I'm fighting for you, for all of us. Indeed. So I think we need to wake up on that, and I think government needs to ratify, that's the thing I haven't said, this protocol, the African Union Protocol, the right to social protection.
Before we talk about the African Union Protocol, I want to come to Fiona a bit. As a lawyer, what are some of the programs and policies in place under the Uganda law pamphlet that probably are embedded in it? Do they even exist?
Yes, they do.
What are some of those? Some of the policies that probably have been embedded in the legal system. Okay, so Allana,
yes,
as ISER,
yes,
what are you doing to make sure that? What are some of the policies probably you could propose for government to embed into law? So
let me be clear. There's a national social protection policy. It's a policy, but usually you want to have a law.
Yes.
Right?
What
that
law
enables,
would you want?
I would want an act, right, that's dealing with social protection comprehensively. Like I said to you, you will have the pension, you know, and you've heard about they're trying to amend that act, the bill, the pension one. You will have one on retirement benefits. You will have one on workers' compensation, which is also part of social protection. So on little, like on niche areas, as they think about the thing, they put a law, right? But it should be the other way around. You should sit and say, okay, what is social protection? And it's all of these things. And then it's okay, let's capture this properly into a law. I gave you an example. That SAGE right now is existing in a legal vacuum. There's a policy that mentions it, there's one, but there's no law where there is SAGE, where the older person of SAGE goes and says, in this law, But a person, government can't play around with your pension too much. There's an act. You understand? But the elements of social protection are not there. And like I said, because it's supposed to be going across the life cycle, and because, yes, it has social security, which is the payments you get, pension, but there is the protection element also means healthcare, education come in. So there's nothing that is broader.
As the African Union Protocol suggests, that it has to cover your life cycle from childhood to old age.
Yes.
Break it down for us. How do I benefit from this protocol?
It means that regardless of your ability or your parents' ability to pay, there are certain basics you will have. The idea, like she said, is to live in dignity, right? So your child will be able to go to school. Right now we know so many kids can't go to school because the public schools either require some fees or they're very crappy, but they mostly require, then they require some fee somewhere, which the president is now fighting, and the private schools are very expensive. Then you find so many girls in particular out of school. You get to healthcare, if you don't have money in your pocket in this country, you die. When you're poor, you die in this country, in healthcare. I want us to acknowledge that. And that's because our public health system is not functioning like a public health system should work, where you can get in and they can work on you. And even if you had emergency issues, they would deal with them, and then, you know, you would be alive. And then when it comes to the fact that, like I say to you, if you don't have money, imagine you don't have any sort of support, you're alone or in the family, or they're all busy with their lives because the cost of living is hard, then how do you make sure you're able to get food and live in dignity, right? And that's where the social security element comes in. If you're a person with a disability, right, are there regular grants coming to you? And that's a good thing, because you get one-off grants here and there, but then they'll go. Are they making for you reasonable accommodation, wheelchair, assistive devices? So I really encourage you all to take interest in the AU protocol, and also just discussions of life cycle of social protection. And even our own social protection policy tries to get at the fact that it should be a life cycle element. That's why it talks about things like national health insurance being part of social protection, because they argue, you know, you're cushioning someone. Even if you don't have money, how do you get health care? And who gets covered? And NHIS that covers everyone, not just the formal sector like they wanted to do in their proposals. So that is where you then benefit. And of course, now think about as a young person, you're here, maybe you are the one person that managed to get through school. You're here hustling, looking for a job. Your grandmother is there, they have no food, they're calling you. This one is called what they call the black tax. No, if there was a social protection system that worked, you would then be able to now focus on your productivity as well, on your savings, because the reality is, and we had this discussion earlier, we have been paying taxes, and Ugandans, you may not realize you're paying taxes, but you pay a tax on your oil, on your what? VAT, you're paying taxes to this government. From the moment you wake up, you put on the light, do you know Meme has a kind of tax on the power? You open your tap, for those of us here, there is tax. Do you people realize how much tax you pay? You are paying tax your entire life. So when you have some hardship, when you can't get it together, there should be a cushion, and it should be provided by government. And that is, I think, why we all benefit when this is done right. And when it's recognized, when I want to talk about the right element, why that's important. It's because when something is a right, there are certain principles that underpin it. Non-discrimination is one of them. If you shouldn't be able to say, oh, for you, like they're doing now, you're 80, but then like what they were doing even earlier before, some districts have, some don't. No, because it's a right to everyone. It means there should be your participation. How many of us are called to the table in the designing of these policies, right? It means there should be transparency, access to information. Again, because it's a right, it's an entitlement. Right now, they're like, oh, if you vote this government,
then you get.
Then you get. And that's really the mentality we're trying to fight. It is your right.
No matter who you support,
no matter who you support, no matter what your orientation, it is your right, right? And that is and when government begins to approach it as a right, it also means for government, it must dedicate maximum available resources. And that's a thing for economic social rights, health, education. What the obligation is, and the government signed on to the International Covenant on Economic, Social and Cultural Rights, and it must dedicate maximum available resources. They will talk about progressive realization, but with the ones you have you put the maximum you can? Or is some going through this channel here? So that is why it's very important that
Allana, you mentioned that as ISER, you're currently carrying out a research to identify gaps, to identify what can be done better. I know you haven't released the research yet, but is corruption one of the limitations towards a very sufficient social protection coverage of the country?
I mean, for sure, because and we argue that the real cost of corruption is that you pay for it with the lack of social protection, with the lack of health care, with the lack of education. And like I say to you, under the African Union Protocol, because you're supposed to find every bit of money, they want the government to engage with things like illicit financial flows that include corruption. Corruption is, we tend to think of corruption here in Uganda, our officials have self-fund, but it's broad. Sometimes it's even the ways in which you've structured your system to allow people to evade tax, right? Where they're technically legal, but it's morally wrong.
If you want, you do.
Yes, exactly. And the way you structured things, if they have clever advisors. So it is a huge cost, a huge cost. It is. I don't think we can develop as a country without beginning to have real conversations. I'm glad people are waking up. One of the discussions I saw in the Parliament thing exhibition or other exhibitions have been coming up. People have been saying, but this money could have funded our social protection for all people, or our health care, or our education. I remember someone began equating some money to capitation. We could have had much more in capitation grants for UPE schools. I said wonderful, but it really is a huge cost on us, and people sometimes say, oh, you can't eliminate it, but the reality is, when there's some that is so, I'm not asking you to go looking for all the pockets of it, like the one you've exposed in your Auditor General reports. What have you done? Look at the cash transfers, right? The irregularities that were brought up in the parliamentary own report on it following that time in 2021, I think, the OAG reports. What has the action been undertaken on it? I mean, I was here
basically
in Jan.
There has to be reviews.
Nobody did action. In Jan, I was discussing the OAG report. And it was a horrible start to the year to start with that report, because you read the things and you're like, yay. And now it's a government official telling them. Allana, so why can't they act? This
is such a passionate topic, I can tell, for you. And it's quite important. And just because we are running out of time, what do you see the future being for social protection in Uganda?
I think if we don't wake up, we don't want to be like now. See, when I think back, 2013, 2018, we were arguing these things. I never thought in 2024, old people would still be getting 25,000 a month.
Yeah.
Like, you people, it's 10 years. Have your salaries not increased for over 10 years? Has the cost of living not increased?
They haven't.
So I think cost of living for sure has increased. I know right now how much is a little fuel, which affects public transport, which affects the cost of food, right? Even just between 2021 and now. So I think if we don't wake up and say, listen, this is very important, and actually pass the legal commitments, including ratifying the protocol, the AU social protection, putting in place the enabling law in Uganda, and then backing up what we have already been put in policy with adequate financing, we will end up stalling. But I think that Ugandans, the most important is for you to wake up. We're telling you it's all right. You're going, as you go into your elections, ask anyone, any party, what are you doing on this issue? Because they're supposed to be able to give you an agenda. They're supposed to be actually delivering on this issue.
For your right.
Demanding. Otherwise, if you look at countries like Denmark, right, for them they started with something very similar to us, experimenting. And now when we look at those countries, we are like, I want to move there.
Fiona, where do you hope to see Uganda in terms of social protection policies and programs?
We need to see Uganda in a very high place, high ranking in Africa, and we can see Uganda in a very high place just in case Ugandans try to improve. They should wake up, demand for social protection because they pay taxes and they have a right to social protection. So when they try to wake up, demand for their rights, and these leaders work hand in hand to combat corruption and try to deliver resources which will help in social protection, I think that will be good for Uganda as a country.
Indeed.
And we shall have to go far.
Thank you so much, ladies, for coming today. Such a very passionate topic, and I think these are the kind of conversations that we need to have to create that awareness of people who did not even know that this right actually exists. Yeah. Thank you so much. Well, right about now we have entered that hour of Kick Start, and I'll be moving towards